With the wrist anesthetized, we can now begin the operation. I've already tied a tourniquet to our incision. Three-quarter-inch incision at the intersection of those lines. Now take the scalpel and make the incision. Nice! I couldn't have done it better myself. Now we'll drill at this. With the transverse carpal ligament exposed, I'll need you to slip a carpal tunnel guide into the incision. This is a blunt-tipped instrument with a groove on the upper surface to the carpal tunnel and underneath the ligament, and is used to protect the underlying nerve and tendons. Go ahead. Once it's in position, you'll advance our special knife down the forward. You will feel it cutting through the carpal ligament. Perfect. Irrigate the wound. When you're finished, I'll release the tourniquet, allowing blood to flow back into the hand. Great! Now you'll close the wound using non-absorbable sutures. With the wound closed, we'll inject additional numbing medicine around the operating site to help relieve some of the immediate pain the patient may feel after surgery. And lastly, we'll place a small dressing. We'll immobilize the wrist with a splint and a sling, and happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually the patient is ready, so let's begin by disinfecting the toe. We need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe. Great! Now we'll wait a few minutes for the toe to get numb. The amount of blood coming from the wound. First, carefully slide one blade of the nail anvil under the affected nail. We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail. Great! Take the forceps and carefully remove the ingrown nail. It's getting kind of messy in there. Let's clean up that blood. See that small bit of pale yellow substance right there? To get as much of that toe is a problem of ingrowth will not reoccur. When you're done inserting the acid, I'll remove the tourniquet and we'll finish up. Finish by applying some antibiotic ointment on a sterile gauze pad. Place it against the toe and wrap it in a gauze bandage. Our patient will be sent home with a prescription for some antibiotics. We'll also clean the wound regularly and replace the bandage. Our patient's toenail isn't likely to regrow. His condition is likely to return if he doesn't take care of his feet. This includes